Good afternoon, everyone. My name is Dale Alexander, and we're excited to have you with us today. If you were with us last week at our summer jam at the Georgia Aquarium, we want to thank you very much. It was a great day. We hope you enjoyed it. If you couldn't be, we had a full day's content. And due to that reason, we couldn't get as deep as we wanted to go on ACA reporting. There's a lot of interest around this issue, and it shows. This is by far the largest webinar we've had so far. Remember, we'll also have this same content next week, Wednesday, July 22nd at 9:30 a.m. Due to the numbers, we have you in listen-only mode. We'll take as many questions as possible. You should see on your screen an area to type questions in, and if we don't get to your question during this time, we'll respond to you personally. Let's get to the content, and to share that with you, here's Travis Riker.
Good afternoon, everyone. As some of you were with us last week at the Georgia Aquarium, this could be a bit of a recap for many of you, but I do know that there were many folks that reached out and said that they were unable to attend, so this is also targeted to make sure that we are able to bring those folks up to speed and make sure that they are fully aware of a couple topics we have on the agenda today. First of which has been on the minds of many people, which is IRS reporting. What are the ins and outs of what we need to know? What are the different reporting strategies? What do the codes mean? What are all of the different forms that we're going to need to be responsible for? What are the various places that we'll be getting data from? And ultimately, how do we put that all together to get that to the IRS on a timely manner and in the right way? We also want to talk a little bit about what the future holds for near-term and long-term healthcare solutions. Many of you have boards and superintendents asking, with the upcoming increase to 746, is now the right time to be looking outside of state health? Or what are the other opportunities in front of us that we need to be cognizant of and be thinking about as we move forward? One thing I also want to let you know is that at the end of the day today, you'll have a very good idea of a couple of solutions that will be available to you for IRS reporting. And one of which is an opportunity that would be at no cost to the district, and we found that to be something of value to many people as we've talked to them over the past week. Digging in first on IRS reporting, just a little bit of a background to kind of bring everyone up to speed on why are they having us do this? Are we expecting any delays? What's the point? And I would share with you, we are not expecting any more delays at this point. Reporting is going to be due January 31st for the forms to employees. E-filing requirements would then be responsible towards the end of March. But as we think about what's the point, the only way to enforce the individual mandate and the employer mandate and understanding who is doing what and our individuals doing what they're responsible for and our employers doing their part is to have this information on forms that go to the IRS, so they can collect that information and then validate that back to either the individual or the employee. So just thinking about that, and that'll make it easy for all the folks on the call today, is that the last bullet point talks about that reporting is due calendar year. That's important. Nobody on this phone call has a non-calendar year plan, so that's easy, but just be thinking about the fact that this is not a fiscal year, this is a calendar year for reporting. And think of IRS reporting much like W-2s. It's a form that's going to be provided to individual. There's a transmittal that's responsible to be filed on behalf of the IRS as well. Digging just a little bit deeper in the spirit of what we continue to do, which is what you need to know for a Georgia public school, and that will be our focus again today, is not talking about the things that are not relative to your particular district, but what are the things you do need to be thinking about as it relates to your medical plan. And that first column, if you will, we're going to go through the gray area, what is responsible at an employee level and who is responsible for doing that. Also, what forms are responsible to be sent to the IRS and by whom. And we have two categories. At the top you have a category called self-funded 50-plus full-time equivalent employees. That would be for your active employees. And that's every Georgia district in the state. And over to the right, you have COBRA and retirees, which is, since those are no longer active employees, those are actually going to be separate forms, very similar to what we're going to go through, a few minor differences. So digging in, the 1095-C, all parts 1, 2, and 3 are responsible from the district to be filing on behalf of all individuals. We're going to define all individuals here shortly. And it's filed by the plan sponsor. Generally, that will be you, the employer. Certainly, there's going to be some information we're going to go through that's going to be the responsibility of state health to provide that information to you. Then as you work your way down that column under self-funded, you also have forms that go to the IRS. This is the transmittal or the cover sheet, if you will, and that's called the 1094-C, along with all of the 1095-Cs that you electronically file to the IRS. Again, you as the plan sponsor for a self-funded plan are likely going to be the ones responsible for doing that. Now, I will tell you, as it relates to the far right column on COBRA and retirees, there is a little bit of uncertainty as to how Georgia school districts are going to be able to do this when that information is either held by TRS, PSERS as it relates to retirees, or possibly even state health, specifically thinking about COBRA. You don't necessarily have all the right information to do these forms. And so one of the things we mentioned at the Summer Jam when our Director of Compliance from United Benefit Advisors was here is a good prudent process is to keep a log of all communications to the state. For example, perhaps you want to send a certified letter to the state saying, hey, I'm concerned about the 1095-B form. I don't know how we're going to submit that information to COBRA and retirees because you control that information. You want to keep that paper trail, if you will, with State Health Benefit Plan if there's something you feel like you cannot do, because ultimately you're going to find that generally the plan sponsor, which is you, is going to be responsible for that reporting. The only difference here is that you got a different form number. The 1095-B is for COBRA. It's going to look and feel much like the 1095-C we're going to go over today. There's one additional section in there. Again, that would generally be done by the plan sponsor, but to my point that we just mentioned, I'm not confident that you have all of the tools and resources to be able to do that just yet. The transmittal form is simply called the 1094-B. Again, much in the same spirit of what you're seeing before. I wanted to just set the stage on what we've done over the past 3 years with the Affordable Care Act. It's been a little over that actually now, and let you know that if you were a client of ours like Waffle House, you have a pretty complex situation as it relates to the Affordable Care Act. But many of you have heard me say this, and it's consistent then as it is today, is that your plans and what State Health Benefit Plan has done for you is put you in a very good position to make IRS reporting in the Affordable Care Act much, much easier than it is for other organizations, even some schools in different states. But for a Georgia public school, I would tell you that your plans are already qualified. It meets the plan design requirements. That's already been decided by State Health. So that's going to very much simplify the reporting codes that you're responsible for. Also, as it relates to individual affordability of insurance, again, that's a calculation of what is the employee's cost of single-only coverage for that qualified plan. If it exceeds 9.5%, there are potential penalties. But once again, State Health has put you in a very good position. There are different ways you can measure affordability, rate of pay, W-2, and federal poverty level. But without getting into the details of each of those, because I'm not sure that's going to be important today, federal poverty level is likely going to be your best fit. And here's why. Employee-only coverage is an income of $11,770 for 2015. It does go up by year. And 9.5% of that number is an employee contribution of $93.17 a month. That is more than the cost of State Health Benefit Plan coverage for a qualified plan. So what that essentially means is that you are going to qualify for the federal poverty level safe harbor, which is going to greatly simplify the reporting requirements that you're responsible for. Let us dig into the 1095-C, and you're going to have us dig into 3 separate parts, and I want to walk through not only what's on the form, but where are you likely to get that information. It's going to be different for each school district to some extent, depending on your technology capabilities and your time and attendance systems and payroll systems. But let's dig into the easiest one first, and this is just the 2014 forms because these were finalized. The 2015 form is still technically in draft mode, but it does not look fundamentally different than what you're seeing today. Part 1 is the easiest. The employee information is that middle white box. It's simply going to be customized for each individual, their name, social security number, address, and then at the bottom, 7 through 13 are all of the informational pieces for you, the employer. Your name, employee identification number, address. That will be consistent for each employee. Likely that is going to come from your payroll system. And then as we keep moving on to part 2, this is where things get a little bit more complicated. This is really where you're talking about an employee's offer of coverage. And then there are really 3 lines, 14, 15, and 16. Line 14 is what's called the Series 1 codes. Not to necessarily worry about all the different codes. We're going to show you some practical examples today. But you have 1A through 1I as possible combinations. And again, State Health has put you in a very good position to simplify that. Line 15 is the cost for employee-only coverage. You may remember for the prior slide, it's $66 and change. But you're actually going to be in a pretty good position not to even have to worry about that for the majority of your employees. Line 16 just talks about the safe harbor codes. Those are called the Series 2 codes. It's 2A through 2I. And again, rather than going through every single individual code, you're going to find some practical ways to do that today to make this very easy. And I wanted to walk through that with each of you today on the phone. The vast majority of school district employees are offered qualified insurance. You may remember as we talked about variable hour employees, which we've covered on previous webinars with measurement periods, stability periods, administration periods. The whole point of doing that is to find out who is not currently eligible for insurance that should be. But what you find is schools are already offering insurance to the vast majority of their workforce, more so than the law requires. So you're already offering what's called qualified offer of coverage. That's going to be called 1A that you're seeing in line 14. The next thing is if an employee actually enrolls in the plan, you're simply going to put in the code 2C. So once again, in line 14, 1A means that there's a qualified offer of coverage. That is the federal poverty level safe harbor, 1A. Line 15 is blank. You're allowed to leave that blank because they already know it's the federal poverty level and that's already affordable. And then simply in line 16, 2C again means the employee is enrolled. The only difference between this slide and the next slide is what happened to line 16. In this example, you are offered coverage, but not everybody enrolls. There's about 20 to 25% of employees that don't enroll in a traditional district. So all you're simply doing in this one is you keep 1A because it was offered to that employee, but then you go with no code. It was released in a recent IRS conference call that if employee is not enrolled, there is no necessity to fill in line 16. So again, the only difference between this slide is 2C means you're enrolled, and this slide says you are not enrolled. Only difference. These 2 codes in and of themselves is going to incorporate at least 75% of your workforce in most situations. Let me get into the one area that gets a little bit more complex, but as I walk you through it, I think you'll start to realize that it's not as bad as it looks. So let's say that many of you are going through the new hire process as you speak. What you have is you're not offering coverage to that particular employee when they're not an employee. So no coverage offered would be 1H. And then if the employee in that case was not employed, you're simply calling that 2A. So what we did for illustrative purposes in the month of January is said that they're not offered coverage because they're not employed, 1H, 2A. Then into February, as an example, there's no coverage offered, continues to be 1C, but the employee is actually in a waiting period. Each of you have waiting periods for benefits. All you're doing differently there is in line 16, it's 2D. And then lastly, come March through the rest of the year, they have coverage available to them, which is 1A, and they are enrolled, 2C. So again, in January, they were not offered coverage, not employed. February, they were not offered coverage because they were in a waiting period. and then from March on, they were offered coverage and they enrolled. If by chance you offered in coverage and they did not enroll, you simply take away 2C from line 16. Now let me talk about something that I know is on the minds of many of you when we started talking about measurement periods, stability periods, etc. That I know many of you are wondering, well, is the process different when the Affordable Care Act says that a full-time employee is 30 hours or more a week? Many of our employees are working less than that, and they're actually already offered insurance. So what would we do for somebody like a bus driver, somebody in food nutrition, etc.? In that case, and I'm assuming that they were employed there all 12 months just for simplicity, is a coverage offering is called 1E. It's just one of the different ways to say that your coverage was offered. In this case, you would want to put the actual cost in line 15 of the qualified affordable plan, which was $66.28. And then again, in line 16, because we've heard many of you say that classified employees come there for the benefits, well, if they were enrolled, it would simply be 2C. So as a review, those offered and working less than 30 hours a week, like bus drivers, food service, 1E for a qualified offer, 2C if they're enrolled. If they're not enrolled, you guessed it, it's blank. The other thing I wanted to point out that's really important is, do all of my employees actually get a 1095C or a 1095B? Or is this something where when we do our variable hour analysis that we only have to send 1095Cs to a certain number of individuals? And in fact, that is the case. This is really important to make mention of. You only need to provide the 1095C if the employee is considered to be a full-time employee working on average 30 hours a week. And you're going to determine that eligibility going back to our webinars that are on the cafe125.com/webinars website. You'll see different practical methods for designing measurement, administrative, and stability periods. But in our analysis of doing dozens and dozens of school districts, we find that this is likely to be less than a handful of people that are going to find themselves from being a long-term sub, if you will, that truly is working on average 30 hours a week over a 12-month period of time. So what does that mean? If you only have, for example, 5 people truly working 30 hours a week, there is still no requirement that you offer them insurance. In fact, we said it may be in your best benefit to not do that. You're only incurring a penalty if they go to the marketplace and enroll and they qualify for a subsidy. And if both of those things don't happen, then there is no penalty to the district. So in that example, again, if you had 5 people, you would only be providing a 1095C to 5 individuals, and hundreds for many of you in terms of the number of subs you have, you would not be responsible for any reporting. One last thing I want you to be careful of, and I know the title slide says sub-teacher, but it really pertains to other classifications of when outsourcing is involved, is I just want you to be very careful. I know I've spoken to many of you on the call today about working with your outsourcing providers, whether that be Kelly Services or others, whether it be maintenance, transportation, janitorial services, etc. Just because you're outsourcing employees does not mean that they are not your responsibility. There is something in the law called a common law employee. I have some basic information that we will put on the website that gives you kind of a Q&A, if you will, of what might a common law employee look like. But maybe more importantly, you want to work with your labor attorney and go back to the folks that you contracted with to ensure that you have the right safeguards in place for the district, that they are assuming the risk and they are fully prepared to pay the penalties in the event that something would happen with any of those individuals. Next, I want to review the last part of 1095C, which is called Part 3. As you might imagine, since you are required to use ADP's HRB enrollment system, they have all of your enrollment data. They have the names, what their elections are, the Social Security numbers of not only the employee but their spouse and dependent children. They know which months they were enrolled in. It's not safe necessarily just to assume that if you have them in payroll, that's also the information you want to put here for what months they're actually covered, and do you even have that information? We have been working with State Health Benefit Plan, and as of the last information that we are aware of, they are still working with ADP on the file. They did actually roll out at the Summer Jam that it would be sometime in September that they would have a file ready for all of us. And that was certainly exciting news, because if you're getting in September, that's pretty good time to be testing your IRS reporting systems in the month of October or November before they become due the latter part of January. So part 3, because you're self-funded, and every district is in the state of Georgia, this information will likely be coming from State Health because they are the keepers of that information. Just as a quick recap, how do you manage all of this? So if we just go through 1095-C, you're going to be responsible for providing that form for all full-time employees working 30 hours a week or more, and for employees eligible for coverage less than 30 hours a week, like bus drivers, food service, etc. Also, don't forget to complete 1095-B for COBRA and retirees. Each of those has the appropriate transmittal form on 1094. And I think we need a little bit further clarity from State Health Benefit Plan. We have sent an email actually out to them asking for a little bit of clarity on behalf of Georgia schools on how they'll be assisting with that. We will relate those findings back to everyone once we find out through our What You Need to Know emails that you see periodically each month. And at the end of the day, what's important for a public school who has hundreds of variable hour employees and multiple different systems that they have to go to for information is you're going to want some type of electronic system to handle your IRS reporting. And that comes in a lot of different shapes and sizes. The first of which could come from your payroll provider. The second of which could come from a benefits or an enrollment system. And software tools, they've built reporting engines behind that to help you. And there are also third-party systems that are very good at also giving you what you need. But one of the number one things we hear from schools is, how am I going to pay for this? We don't have that in the budget. Our budgets were approved, and we didn't necessarily put anything in. We didn't know what to put in. We didn't know what State Health was going to do. We don't really know what our payroll provider is going to do, etc. So I wanted to just break down a couple of simple examples. If an average school district is 1,000 employees, you really have 4 methods of delivery that you have as options for you in the district. The first would be going to the provider directly. The danger in going to someone directly is that they're not really familiar with the intricacies of a Georgia public school and some of the specific provisions of the law that apply to you. It also happens to be the most expensive option. You could go through your benefits advisor, where they support and understand your unique needs and understand what your needs are. And they also likely have scale and resources that give them the same types of systems that you could get on a direct basis for a far reduced cost, shown there in the $7,000 to $9,000 range. You also have access to go through insurance companies. And I know that some of them might let you know that it's at no cost. And what I want you to be aware of is that there is a cost for the service, regardless of where you get it. And what's important to know is the quality of the insurance products that you value and give to your employees, is that going to be impacted in any way by any of these models? And my only concern or feedback I would give you is that insurance companies that you go to directly that sell a product typically would not be the most cost-effective and maybe not the richest of benefit plans if they were going to give something like that away for free. So what you typically see is the quality of their products and the price diminishes. The last and one thing that we've done over the past couple years that we wanted to just kind of bring up and make people aware is that there is one other method or opportunity for someone to not have to come out of pocket as a district expense through something many of you have benefited from called the Shared Savings Program. In fact, what's unique about that model is it actually helps you solve a healthcare problem with a healthcare solution we'll review here in just a second. And it actually can put savings back into the district as well as increase employee income as a result. And it's all about making the right types of behavioral elections, if you will, for healthcare that are in the employee's best interest. So one thing I wanted to do as we transition to what the future holds for state health is, I think many of you have seen us present this slide with one little edit there at the bottom, is that there was recently an announcement, not a dollar amount, but announcement that classified healthcare is going to have another cost shift. Why that says fiscal year 2016 is that all the changes up until this point were fiscal year. But at this point, they've announced that the change will be January 1st of 2016. Verbally, we have heard it will likely go to what it was supposed to do at the third year of 3 cost shifts, from 446 all the way up to now what will be 746. It's a pretty substantial increase in local district funds that are going to be needed to continue to support classified health insurance. So I bet none of you have been asked from your superintendents or the board, hey, we have to stop the bleeding. We just can't continue to absorb these cost increases, and we need to find an alternative solution. And so the purpose of that red line is to give you an assessment of what would the private market look like. We have recently, in the past few weeks, with about a half a dozen school districts of all sizes, from extremely large to some of the smaller districts with a few hundred employees, gone out and taken a look at the claims experience provided by State Health Benefit Plan. And one of the things you find is something called a loss ratio. What that means is how much are we paying in revenue versus how much is coming out as a claims expense. And if the number is anything north of about 70 to 75%, that is not necessarily going to allow you an opportunity to go find something out in the private market to your advantage. And I would share with you of the examples we have seen, some of them, actually most of them, have been anywhere from 90% loss ratios to over 100%. So it's just not going to allow you an opportunity when the cost is still being subsidized by the certified and the state employee trusts to go out at this point in time and set up a local plan. It's very possible that in 2017 that if there's another cost increase, and we did see a memo from the consultant at State Health Benefit Plan recently that suggested that there is just not enough revenue coming from the classified trust to support the claims that are there. So what that essentially is telling us is that costs have to continue to go up. A recap of what we have probably reviewed as we've met with schools over the past 3 to 3.5 years when these first announcements came out, which is what are all of the possible solutions available to us. I would tell you we are in the business of being healthcare benefit consultants and setting up healthcare benefit plans, and I will be the first to tell you that your best interest is to stay right where you are with State Health Benefit Plan. It is not the right time, nor in the best interest of the district, unless you are an extremely large district with a very favorable claims experience. The opportunity will not present itself. That could come in 2 different forms. It could be a local plan, or it could be a multiple employer consortium. But keep in mind, you're already in a consortium now. You're in the largest consortium available to a school district. So the only way a consortium would make sense is if you had the opportunity to get with a few of your friends and probably a geographic region, for example, ERISA, and all of your claims experience was favorable and better than what the state has seen. Statistically, that is just probably not a likely scenario. Is it possible? Certainly, but we just don't see that. We also talked about employee outsourcing. Many of you have outsourced employees for many good reasons. I would just suggest that if you're doing outsourcing because of the Affordable Care Act, you probably don't need to be thinking about that for the purposes of ACA. If you're thinking about outsourcing for other reasons, other business reasons, then that certainly makes possible sense. And at some point in time, The federal and state exchanges are going to be a possibility. In the state of Georgia, that is a federal exchange. But at some point, that could be a very viable option for employees. But you've heard us say this before, my grandfather's analogy, who's a farmer, every solution has a season and timing is everything. And right now we believe the best timing for long-term solutions is to stay right where you are with State Health Benefit Plan. Let's take a look at what the financial impact would be and maybe what that might look like from a near-term solution perspective. As a recap, certified employees is a QBE pass-through. That's a state-funded, and now for all you finance directors out there, I know that you could be above the QBE formula to some small extent, but for the most part, your certified employees is a pass-through cost, and currently that's $945 times 12. It's a little over $11,000 a year. But your classified employees are locally funded, and we are getting into the third year of that cost increase. We do project it to be $746. So I want you to be thinking about what that $1,800 a year increase is going to do to the district. And to illustrate that, I wanted to give you an example of, if you were to look at this slide, find the total number of classified employees you have, and take a look at what the 3-year cost curve is really looking like. If we continue to use the average school district of 1,000 employees, your cost went from $5.3 million to $7.1 million local funding. And it's expected to go up another $1.8 million over the next 12-month period of time. That's nearly a $2 million revenue issue that you continue to have to grapple with. And I know that many of you don't want to continue to have furlough days, decreased class sizes, etc. So one of the things we challenged ourselves with was how can we help schools, while remaining with state health, to look at something that would be beneficial for them and also dealing with this significant burden to the district. So many of you have heard us talk about the shared savings program. In simplicity, what this is an opportunity for employees that many of you think classified employees actually come there for the benefits. And I would suggest that the vast majority of you are right. But there actually is a percentage of people, somewhere between 5 and 10%, that if given an opportunity to look at coverage elsewhere, as defined by some of these categories, you would actually find that they would voluntarily go somewhere else because it's in their best interest. But they might need some encouragement or a financial incentive to get them there. You've probably seen that single and single coverage with State Health Benefit Plan gives them double the employer contribution of $596, but it actually costs the employee less. So it's cheaper for the employee to go single and single rather than going with employee spouse. It really surprised us to look at the second one when it comes to double coverage, but many people still have double coverage thinking that not only will they have coverage at State Health, they also can have an opportunity to have coverage somewhere else and benefit from that. And due to coordination of benefits, that's not always possible. We're in a society now where more and more spouses are working, so they have other opportunities to have access to insurance. One thing we've definitely found with school districts here in Georgia, actually across the country, is that there are many that are over the age of 65 that have never been communicated the value of Medicare. What is it? How does it help them? What are really their options from an education perspective? What would it look like if they even wanted to consider that? But we have seen many people drop state health and go on to Medicare with supplements. And then lastly, due to healthcare reform under age 26, you're familiar that if you have a dependent under the age of 26, they could go on their parents' plan, and for some type of paraprofessional potentially right out of school that doesn't have to go buy health insurance, which is a significant expense to them, that could put a tremendous amount of money back in their pocket. So as an example, if you had a wife work for XYZ County Schools and a husband worked for a private employer, they have an option to buy coverage one of 3 ways. They can take in that middle bucket, single and single. They could take spousal and employee coverage under State Health Benefit Plan, or they could go under the husband's private employer. And most people think with their wallets, I'm certainly assuming that benefits are roughly comparable here, but if they are, the least expensive option, just like they're doing with single and single now with state health with a husband and wife that works there, they're going to go with that option. But it's important to know what that means to the district. And I'm just looking at the current, the future cost increase of what that means to a district. Regardless of how you enroll employees with state health benefit plan, it costs you $8,952 or will from $7,152. But what if you were able to take some of that dollars that you were spending in revenue towards going to state health and carve some of that out in terms of a financial incentive to share in the savings, that if you were to give some of that to the employee and they bought coverage somewhere else, there would be a win-win for everyone. The employee would increase their take-home pay, and the district would therefore save money because an employee has voluntarily made an election that they have access to insurance somewhere else. And that way you're not funding anything to state health. And so what you find is that a $45 a month difference to a couple is costing the district nearly $9,000, soon to be in 2016. Just to give you an idea of how Georgia districts have benefited at this point, there have been 13 districts that we worked with over the past couple of years, saving a little over $2 million, where just under $1 million of that is income to employees or incentives that they had put in their pocket because they had access to insurance somewhere else. And then there's a net district savings of a little over $1.2 million. Now, one thing that's important is that those numbers assume the $596 per month that you've been currently paying. As the district expense goes to $746, an extra $150 a month or $1,800 a year, the districts are going to save another $1,800 per employee per year. That's a pretty significant additional expense. So if we were to make some projections based on our successes over the past couple of years and looking at the results that districts have seen, what this shows you is the total number of employees on the far left. So you'd find the total number of employees you have and then work your way over to the right. I'm only assuming this is at 596. I did not do a projection for 746 at this point, but as you just saw, you're just going to increase that amount, $1,800. But if you had a district with 1,000 employees, you would save just under $100,000 to the district that could be used for multiple reasons and put an additional $73,000 back in employees' paychecks. So if we were to give you kind of the rules of the road or the lessons learned over the past 2 years, what are the things that make a program successful? And we can certainly share the good and the bad of how this would need to work and what type of support would you need to do, what are the things you would need to consider. The first is to set the proper eligibility rules and the funding formulas. You want to make sure you're offering this to the right people. As an example, you would not want to be offering this to certified employees. And in fact, state health would even tell you that that is a mistake. It's actually going to end up costing you long term as it adjusts your QBE formulas because you will lose funding for those individuals. You also have an ability to look at your census proactively and find out what situations those employees are in, single, Medicare, under age 26. Who are some people that we might identify proactively as someone we want to work with? You also want to be thinking about if you offer an incentive, you want to make sure that it's enough to provide an incentive, but not too much that you're giving away all the savings. So you want to look at local employers in your area and do analysis of those. Also look at credible benchmarking data like we have through United Benefit Advisors. Maybe most importantly is, can we legally do this? And so State Health Benefit Plan, as we worked with them throughout the years, has given the blessing to do this on the classified employees. And so there are certain things you want to do to make sure your enrollment forms are legally compliant, and your plan documents and your Section 125 plans. And then lastly, and this is where we found the biggest opportunity to share in the success of folks that have really taken ownership of this to get great results, is a communication strategy with board and leadership and then how you communicate that properly to employee groups as well. But there is a necessity to kind of make sure your board is understanding of what the benefit is. It's important that your leadership team and department heads understand the value and what this does for the district, but maybe most importantly, going to those employees and letting them know what choice actually means to them, that there is another option potentially available. You want to prepare for open enrollment, presentations, prep materials. Many of you have seen the videos we've done for State Health Benefit Plan. We'll show you a screenshot of that, and we look forward to continuing to do that. But what you find is that employees just don't know with healthcare how to make the right decision. There's just too many options. So what are some really easy things you can give them to make good decisions for themselves? And then lastly, for those districts that currently call our call center, we simply flip a switch and we provide the healthcare expertise and advice for their employees to make good decisions on State Health Benefit Plan and to provide that extra layer of support. So I did just want to thank everybody. I'm going to turn it over to Dale here soon.
I have a question, Travis. The
Yes.
communication strategy that you have, we recently brought a very large school out of a state health plan in another state, and it was a couple-year project, and the communication to the community, to the stakeholders, to the media is a very big part of something like this.
Yeah, it's important to know that when the opportunity does present itself, and you're in an opportunity to look outside of State Health Benefit Plan, and I would encourage you to start getting your claims information from State Health Benefit Plan. Archive that information, because what you need to have to leave when and if that opportunity comes is claims information. Also, one more note. This is really important. It does not include your retiree data. That's an important point to note. Now, I don't want to overemphasize retirees, because when we look at the own consulting actuarial studies that the state has provided, for the most part, classified employees don't have a number of retirees. They don't typically retire, or they retire much differently than certified employees do. But it is important to know that when you're doing that, it is as much a communication strategy as it is making sure you have the right healthcare consultant. We certainly have expertise to help you. I just, again, think that's somewhere down the line.
This is going into our third year of doing shared savings, and it's tested and proven, but these drivers of success are so important. And keep in mind, there are many of you on the phone that are not clients of Alexander & Company, and if you have an existing advisor or an existing insurance agent relationship, you could still use Travis and his team to handle the shared savings program for your system and keep who you have. And by the way, we have many systems that you can contact regarding shared savings for testimonials. Travis mentioned some of the communication tools, and you all have seen some of the videos that we've done. Our State Health Benefit Plan video, we'll be planning to redo that and send it out across the state this fall, a shared savings video as well. So again, going back over the methods of schools that say, how do you get reporting? How do you pay for this? What are the ways that we're going to hear that we can do this? And going back to his 4 different models, directly to the reporting providers, those companies that do that individually, that's their specialty. You can have your advisor supported model. You can have the insurance company model, where insurance companies can do this for you, and they usually price that into their products. And then the shared savings program that Travis just went through. In looking at questions, Travis, did you have any questions to answer?
Yeah, I know there was one question on, do we have software ourselves that can assist districts with this? Travis, I appreciate you trying to simplify this for us as much as you can, but I'm not an expert at ACA. Yes, we'd certainly be honored if that made sense for you, to assist you, whether that be through the shared savings program, where we would also include IRS reporting as part of that scope of services, so there would be no cost to the district. But we also have some folks that just say that, that's not the right decision for me. We just want help with IRS reporting, and we have a budget for that, and we'd like your assistance. So I would share with you that the software is generated in a capacity that makes all of this really easy. One thing that's important to note, though, regardless of the options that Dale talked about, whether it's direct, through an advisor like us or someone else like us, insurance company, whatever the model is, it's important to know that you are going to be responsible for gathering the census information and the data. So, for example, you have to get the names, the addresses. You're going to have to know the proper codes that have to be decided upon. We're going to have to get the information from State Health Benefit Plan. There's still a requirement that regardless of which model, the system is only good as the information that goes into it. And I know that's a concern for most of you. So to the extent we can help out, we'd be honored and happy to do so. But we know that there's many options that you have in front of you as you make a good decision. Let me go over a couple questions that I'm looking at. One was reporting periods. Going back to the prior webinars, if I was to simplify this for you, think with the end in mind as you're doing variable hour analysis. And most of you think of that as substitutes. It could be coaches, although I would argue that coaches are seasonal employees and excluded. But let's just say it's substitutes for simplicity. You want to think with the end in mind. And with the end in mind, the Affordable Care Act and IRS reporting starts 1/1 of 2015. So what you want to do is you want to work backwards. So what comes right before the stability period? The stability period is 1/1 of 15 through 1/1 of 2016. So if you're thinking with the end in mind and 1/1/15 is the starting point, one suggestion that I think would work well, and it fits well on a calendar too, is go back 61 days or go back to November 1st of 2014. So what I just said is from November 1st of 2014 to December 31st of 2014, that would be your administrative period or the time that you are making the actual calculation. I think you're going to find that most people are not going to decide to offer substitutes coverage, but that gives you that administrative period to make that calculation. So again, 11/1 of 14 to 12/31/14. You can go back as much as 90 days if you would like. This is just an illustration showing 61 days that I think would work just fine. So then what is that 12-month period of time, Travis, that I actually have to go back and start looking at every single employee's hours month over month to figure out who truly is 30 hours? And yes, I did say it's not just subs. It's going to be very easy for you to track the vast majority of your workforce because they're already working 30 to 40 hours a week. So you are required to track the hours every single month for every single employee. And you're going to be putting that into an ACA software tool of your choice to do that. So what that means for variable hour employees like subs is if we were to go back from 11/1 of 2013, 11/1 of 2013 through October 31st of 2014, that is a 1-year period of time. Again, 11/1 of 13 to 10/31 of 14. That's a 1-year period of time. You then have your 61-day administrative period from 11/1 to 12/31, and then your stability period. Now this is really important. This is not a one and done. This is something you continuously have to do every single year, every single month as you're tracking this information. Now you're also going to see on our website, and for the sake of time I won't go into the details today, there is a separate measurement period called the initial, or for your new hires. So you're going to want some type of system, regardless of what it is, to be able to track these different methods, because there's constantly going to be a revolving door of information that you're going to want to look at a dashboard on this ACA software. And a dashboard will tell you exactly who is approaching 30 hours, who's not. Another question we get is, can we limit hours? You certainly can. If you see that one of your employees is approaching 30 hours a week and you can find, for example, another sub to do that job, then there is no requirement that says you have to let that person come back and work. You can eliminate their hours. Okay? So we have software tools that can give you these dashboards, all the reporting, fill out all the 1095-Cs for you, fill out your transmittal forms, fill out your COBRA retirees. All of this can be made very, very easy with technology, much like Alexander and Company has done for years with your benefit systems and sending that information to insurance companies. There's no more manual forms and processes that you're forced to deal with. This is exactly the same thing with ACA software. There's very easy software that you can put basic information in, and it will take this off your plate with the limited resources you already have, so that goes away.
Travis, you mentioned the reporting webinars. Those are the prior webinars that we have that are on cafe125.com/webinars.
Let me see what other questions we have. Just give me just 1 second. And by the way, if I see something on the board here is maybe a little bit deeper that would require a little bit additional follow-up, know that I will get back to you and everyone that's joined the webinar today so they can understand what the question was and also what the response would be. One particular question is, does this exclusion include long-term subs? It doesn't really matter as it relates to tracking employees. You are responsible for tracking the hours of every single employee. So for example, remember that you have up to a 12-month period of time of 11/1 of 2013 to 10/31 of 14. A long-term sub for many schools is someone that's out on maternity leave. So for 90 days, they're working 40 hours a week. But 40 hours a week over 90 days and 0 the rest of the year does not average 30 hours a week. Or maybe it fluctuates. They come in a couple different times for different teachers. The bottom line is you get to average 30 hours up to a 12-month period of time, and one way to do that is 11/1 of 13 through 10/31 of 14. Next question is, are employers with less than 50 full-time employees, ERISA, still exempt from this? Excellent question. Any employer in the United States that has less than 50 employees has absolutely zero responsibility as it relates to the employer mandate, IRS reporting, these pay-or-play regulations. This only becomes an issue for districts, and every district that I'm aware of is going to be over 50 employees, and the vast majority, 99%, are over 100. There is a 1-year kind of transition time for employers between 50 and 99 employees that there are no financial penalties. However, you are still 100% responsible for doing the IRS reporting. So IRS reporting is due for any employer over 50 employees to as big as you are. Just looking over a few more questions to benefit everyone. As a recap, when is the IRS reporting due? Your 1095-Cs, if you will, to your active employees, those are going to be due by January 31st, 2016. The actual electronic transmittal, you are going to be required. This is another reason you want a system. I might have overlooked this just because I've seen it so many times. This is important. You must electronically file this with the IRS. So you're going to want a system that has the capabilities to do these EDI feeds, if you will, to the IRS, and that is due by March 31st. An important note, because we have different schools of different shapes and sizes, is that electronic filing is only required, like the W-2 reporting, for employers that are greater than 250 employees. If you have greater than 250 employees, your only option is to electronically file. There is no other option. If you have less than 250, which is very few districts, you can manually do this. However, I would tell you that's a pretty big task on resources that I know for many of you are limited. Let me come over just a couple more questions here. Do we have systems to help you? Yes, we do. I don't want to overemphasize our system because it's not about our system. It's about providing you a system. I don't care, again, where you get it from. Payroll, benefit administration systems, or for third-party systems, we have all three of those options. I would share with you, we have a strategic partnership with someone that as you look at the slides on the internet right now, our model is going to be likely less expensive than that. And there is a way through the shared savings program, looking at the far right, where we can give you IRS reporting at no cost to the district. We simply absorb that expense in the shared savings program. And the positive side is that in the meantime, not only are you getting IRS reporting from healthcare's advisors that understand Georgia schools, but you're also able to save money at the district and also put money back in employees' pockets.
There's another question that just came in.
Excellent question. Do the summer months, when subs or any employee except administration, do they get averaged into the 12-month period of time, or do they have to get carved out? There are a few different special rules and intricacies of the law, one of which is for K through 12 public schools, pardon me, that says any break in service of more than 4 weeks. That's not Christmas break. That's not Thanksgiving break. That could be summer break. Any break in service of more than 4 weeks, and on average, Dale, correct me if I'm wrong, summer breaks are usually 8 to 9 to 10 weeks. So what that essentially means is that you can do one of two things. You either have to give all of those employees credit as if they were working during those 8 or 9 summer months, or you take that out of the average and calculate by a lower number. Excellent question.
Thank you, Travis, very much. And folks, we're thankful for your attendance and we appreciate your time. Just want to let you know that these webinars are recorded. We have our last 4 online at cafe125.com/webinars. They cover the various reporting periods that Travis talked about. We have our upcoming webinar again next week. We'll hold this content again. If you need a refresher class or if you want colleagues to listen in, please pass this on to them and join us. Should you need assistance, guidance, or to just sit and share a cup of coffee over this topic, please give us a call. We'll be happy to guide you any way that we can. And just know that we're here. We truly appreciate each of you, and we thank you for being with us. And we'll see you soon. Take care.